Good day everyone, I am Danica Lupasanting and now I will be performing Leopold's maneuver, return demonstration. So Leopold's maneuver are a series of 4 systematic steps used by healthcare professionals to assess the position and presentation of a fetus within a pregnant woman's abdomen. These maneuvers help determine the fetal part that will enter the birth canal first and guide clinical decisions during labor and delivery. So before the procedure, we need to prepare the equipments, which are stethoscope, clipboard, ball pen to document the observation made. So first, the most important of all, we need to perform hand washing to prevent the transmission of infection in healthcare setting, ensuring the safety of both patients and the medical professional. So next, explain the procedure to the patient. So, hello ma'am, today I am going to perform procedure called Leopold's maneuvers to assess your baby's position inside your abdomen. This will help us understand how your baby is positioned and how they might be positioned for delivery. It is a simple and non-invasive process that involves 4 steps. These steps help us make informed decisions about your care during labor and delivery. It is a routine part of prenatal care and doesn't cause any harm or discomfort. If you have any questions or concern, feel free to ask. Okay, ma'am? Are you ready to proceed? Okay, thank you, ma'am. So now, the most important of all also is the client's privacy. So now, ma'am, I will be going to close the doors and windows, ma'am. So you are going to comfortable, okay? So next, let the patient empty her bladder before the procedure. So now, ma'am, before doing the procedure, ma'am, I want you to encourage you to void first so that later you won't feel uncomfortable. Emptying the bladder before Leopold's maneuvers enhances accuracy in assessing the baby's position and improves patient comfort during the procedure. Okay, ma'am, so you're back. So next is position the patient on supine with one pillow under her head and with knees slightly flexed. So as you can see, the patient is now in supine position. And now I will going to assist the patient so that her knee is slightly flexed. Okay. So next is, if right-handed, stand at the woman's right facing the patient. Faces the patient and the palpates the uterine fundus to determine what part of the fetus lies in the upper part of the uterus. So first, palpates in a downward direction on the side of the abdomen, applying gently but deep pressure to determine the position of the fetal extremities, the fetal back, and the anterior shoulder. So now, ma'am, I am going to start the procedure, ma'am. So now, ma'am, I am going to perform fundal grip, ma'am. First, I'll gently feel the top of your belly to determine which part of the baby is up there. Okay. So next, places one hand over the symphysis, pubis, and grasp the lower uterine segment between the thumb and the fingers to feel the presenting part. Okay, next, ma'am, I will be performing lateral grip, ma'am. So, I press on your side to see where your baby's back is. Okay. So next is turns and faces the woman's feet to confirm the findings of third maneuver and determine the flexion of the vertex. So now, ma'am, I will going to perform pelvic grip, ma'am. I'll feel around the pelvis to figure which part of your baby is closer to the birth control. Okay. So next, locates again for the back of the fetus and places the stethoscope over and listens for the fetal heart tone for 1 full minute. Okay, ma'am. So now, ma'am, I will be going to perform suprapubic grip. Lastly, I'll gentle press the above of your pubic bone to confirm the findings and assess how much your baby's head is engaged with your pelvis. And after that, I will be going to listen for the fetal heart tone for 1 minute. So now, ma'am, I will be going to listen the fetal heart of your baby. Okay. So next is notes the location, rate, and character of FHT. Okay. So and also we need to make the patient comfortable. So we need to sleeve up the back of their t-shirt. Yeah. So next is after the procedure, I have determined that your baby is at your right side and your baby is in a cephalic position, which means the head of the baby is at the lower part of your uterus and it is already engaged. This is an uterus and it is already engaged. Ideal position of the baby. For labor, also when I was listening for your baby's heart sound, I have counted and it is 125 beats per minute and that is normal. Do you have any questions, ma'am? So next is documents the observation made. The fetal presentation, position, attitude, and whether engaged or floating. And after the procedures, we need to perform hand hygiene. Okay, ma'am. So thank you for your cooperation, ma'am. Again, ma'am, I am Danica Lupasanting, ma'am, and I am a student for today, ma'am. Thank you so much.